Hi, this morning I'm going to talk about pessaries. I want to talk about what they are, when they may be useful, and how to access a fitting. Pessaries have been around for a very long time. They're not new. They've obviously changed and evolved and advanced. But essentially, it's a device that's used vaginally to better support a change in position of the vaginal walls, and that could be the front wall, back wall, the uterus that's descended down, or for women that have had a hysterectomy whereby the vault descends down, whereby if the uterus has been removed, the vaginal vault can move down. So prolapses are fairly common actually, and I'll talk about prolapses in a separate video, but a lot of women either don't know they've got a prolapse, which is a good thing, or something will happen, can often be around menopause, perimenopause, where estrogen starts to decline, or for example if you start doing a new sport or a new activity, or do something, it's less likely, but something like heavy lifting or digging or something that's very, very strenuous, or develop something like new straining, constipation, that can also put quite a lot of pressure on the pelvic floor. So there are a few risk factors that can worsen symptoms of prolapse. If you have symptoms of prolapse, the main things that you'd feel are heaviness, dragging, descent, something sitting lower. Some women talk about a tampon has moved down, or that there's pressure or something uncomfortable in sitting. Towards the end of the day, things may feel more uncomfortable. Now, NICE guidelines, the 2019 NICE guidelines, recommend conservative management for mild to moderate prolapse for all women as first line treatment, and within that, pessary management can be part of a treatment plan for women, which means that actually for most people you're not going to need surgery as definitely as a first option, and that actually symptoms of prolapse can be well managed within community settings, via GP, private practices like mine, or somewhere whereby you don't have to necessarily go into a hospital setting, and actually the options are really, really great. So I'm going to show you a couple of pessaries. Now there are loads of different types. There are, I think, over 25 different types of pessaries. For mild to moderate prolapse, generally something to support the walls laterally and from above, something like this, like a ring pessary, with or without the inner support, if you like. Most pessaries that people see don't have this membrane in the middle. This is a ring pessary. It's made of medical grade silicone. It's very mobile, so you can do it with one hand. These will be inserted either ideally by the patient, so by you. They'd be fitted by a healthcare practitioner. Make sure you've got the right size. There's a whole process to go through in regards to measuring and making sure that the right type of pessary has been chosen, that it fits properly, and that you know how to insert it, remove it, clean it, and manage it. The signs and symptoms to be aware of when using a pessary. But overall, they're a really safe device to use. And the joy of them is, if it's uncomfortable or it's not doing their job, you just take it out and let the tissues have some time out. So this is a ring pessary. Generally used for more front wall and what we call apical, so movement from the above and movement from the front. Less good for back wall prolapses, for rectoceles. This is a cube pessary, so as you can see, as the word describes, it's very much like a cube, very much like a dice. And the idea with this one being that because of the way the suction has been designed, this can support from different compartments. So these are really helpful for descent above, front and back, and these devices, again, they're really soft. I mean, that is very, very soft. And once these are inside, they need to be pushed up high enough. So if you imagine that the wall has descended here, this pessary is designed to lift up so that you don't have that pressure coming down, and it's supported from a high position. And again, these types of devices we need to ensure that you can remove them safely and that you can do that. These are generally used for more sporty people, so younger people probably, women that want to run, play sport. They can be inserted, used for an activity, maybe a night shift, or people that do long time on their feet, and then removed. These can't stay in for more than 3 days, where a ring pessary can. So there are different criteria around how you use these devices, but these are all things that your healthcare practitioner will go through with you. So I just wanted to kind of show you what they are. They are a really nice additional option. You can use as much or as little as you want to. They're safe, and I think they're a very, very useful adjunct to standard physiotherapy care.